Hi everybody. So my presentation probably be slightly different to what I planned because everything Gemma said I don't need to say. So we'll see what happens to this. This is a story about Hong Kong SPCA's journey through engaging with various sort of stakeholders and educating ourselves as well. We've just celebrated our official 100th anniversary. So why manage cats? It's the same reason that we think about managing dogs. We're looking at cat welfare, veterinary public health concerns with zoonotic diseases, cat nuisance complaints. If you've got a tomcat and a cat in season on the street, there's a lot of complaints about the noise they make, and obviously conservation issues. Background for Hong Kong, we did have a rabies outbreak in the 1980s. So we have a lot of free-roaming owned cats and some working cats as well. So shop cats, cats living around sort of facilities, farms, more rural establishments, and very low desexing rates historically, primarily linked to low access to veterinary care, and obviously historically spay-neuter wasn't as well accepted or broadly available. And again, low awareness of what we should be doing for our pet cats, and different concepts of ownership status, and a very, very reactive animal management approach from the management authorities in that they only react on complaints, so they weren't doing any proactive education or management of animal populations. So this is some historical data. 1982, which was just before or just at the start of the rabies outbreak in Hong Kong, there were 133,000 cats reported. And then that dropped in 1998. So I'm not sure whether there was the various factors, the rabies outbreak, probably a lot of animals were killed during that process, that period of time, and also probably a change in the environment, less rural, less traditional housing, more move to high-rise, etc. So we got a change in the pet population. And from 2005, we've actually had double the pet cat population. But those statistics don't measure the non-pet cats, so your feral cats or your street cats, probably not your working cats as well. So we've got those gaps in knowledge about the population. We had a large number of street cats, free-roaming cats. You'd walk around the street, you'd see sick kittens with flu all the time. And we were also having a very high euthanasia rate. So when I talk about euthanasia rates here, we're not able to separate out died in care from euthanasia, from humane killing for population control and true euthanasia. And also the statistics I'm reporting are SPCA Hong Kong statistics combined with the government statistics as well in terms of euthanasia rates. What do we need to do when we're engaging? So these are all the people that and groups we need to engage with, so volunteers. So we don't call our semi-owners, we call them cat colony carers or volunteers. We've got the pet owners, so the true owners, the government in terms of lobbying, policy change, etc., and partnerships, facility management. So we live in housing estates, we've got building management, etc. So if you've got street cats or feral cats around, or you want people to be able to own cats in buildings, then you have to have those relationships as well. Again, people who are supporting you, advocating for you, sponsoring your programs, etc. And in other important areas, community leaders. So in villages, talking to village heads, local community representatives, and again, experts in KOL. So now with social media, key opinion leaders, going to your social media stars, getting your celebrities on board, getting the message out there. And another area that we can also tap into is some corporate social responsibility programs. So people in corporations are looking for projects. They want to do this engagement. They're working on their own staff well-being programs. They're looking for these outreach opportunities. And they can come in and help you, and you can also get the messaging out. And through that community engagement, you can spread your message wide. So the graphic on the left is an old graphic we use, which is about the holistic solution to oversupply of companion animals. We need to look at the feral, truly unowned population. We need to look at the working animals, so the animals in the shops, factories, etc. We need to look at the pet trade and also work with our educating our general pet population owners. And I think also we need to consider, if people alluded to, that we are looking at the animals in a human context. So we've got to think about the politics that's involved, people's different ethical approaches, the environment, and also the economics as well. So what you can do in one situation with a certain set of circumstances and a lot of money is different to what else you can do as well. Sorry. So this is some of our engagement, so working directly with the feeders. As we've heard from Gemma, there are a lot of people feeding cats, so probably about 10 to 20% of the cat feeders will actively engage with your program where you want them to actually desex. And we say that our cat colony care program, which is our feral stroke street cat program, is not a cat feeding program, it's a cat neutering program, and we sort of try to say if you're feeding a cat you should neuter it so you're not actually causing a bigger problem. Again, on the left we've got some of our CSR sort of volunteers, and they're from the Hong Kong Jockey Club. They have a CSR program, so they come out, they're helping to make trap covers, and they go out on cat trapping exercises, supporting our team in the field if we're doing that with the volunteers as well. Very, very important to educate yourself. There's loads of resources out there. So you've got the Million Cat Challenge, you've got International Cat Care, you've got ICAM. And this is a graphic that we have used in the past, and don't use graphics like this. I mean, it can cause horror if you go in. And we used to use this, like, you know, the triangle, and one cat will end up with 1 million or so cats after 10 years. But there is actually better research and there's better graphics to use. So please, when you're going out and trying to lobby, don't use something that's going to cause a knee-jerk reaction, because all people see is, oh my God, there's so many cats that will come. We can't do this program, because they misunderstand your graphics. But it is really, truly about human behaviour change, and we're always resisting change all the time at all levels. We don't like it. We much rather have the status quo. And as I say, the gaps are that if you know something, doesn't mean you'll change your behaviour. You may have an attitude change, but again, you may not change your behaviour. And you may have the intention to change your behaviour, but you probably won't do it for whatever reason. So we need to go through these stages as well. Again, we want those behaviours. We want them to be model, rehearsed and reinforced. And actually, a lot of our work has actually been through social learning theory. So basically, it's actually getting the message out there and word of mouth, copying behaviours, etc., and mainstreaming. So having some conversation with sort of an ex-director of Agriculture and Fisheries and Conservation Department. He said, oh, you guys have done really well. You have mainstreamed TNR methodology. So basically starting through grassroots, through the volunteers, through practicing it, we actually got it mainstream, so it was broadly accepted, and the benefits have been recognised as well. So again, these are all the observational, the learning theories, but again, most of the time we're actually copying. So we're either copying experts and following what they say. We're very rarely doing our own sort of independent thought process, and also copying peers. So this is where you KOLs, your word of mouth on the street with the people who are in the communities. There's a lot of social networks now. People are very connected. The cat feeding community, they're all connected. There's loads of Facebook groups. So getting your copying out there, getting your experts to advocate it, your community leaders to advocate it, and then getting the peers to actually advocate, then you get the message out there. Sharing experiences, so we're very happy to host anybody. So anybody's coming through Hong Kong, come visit us, and we're happy to try and share. So we do a lot of sharing in China, trying to support our colleagues in mainland China. Talking about the methodology, of course, China has its difficulties with the dog and cat meat trade there, but there has been some positive impact there as well. Again, lots of education for pet owners, educating that they need to take the responsibility to actually play the role and trying to change their behaviours. And also we need the supportive legislative environment as well. So in terms of having animal welfare legislation, possibly cat management or ownership legislation such as mandatory microchipping or things like that may help you in terms of tracking abandonment. Access to veterinary services is very, very important. We need the vets, of course, which is a big problem these days. Facilities and equipment and access to drugs, and access to proper drugs is a big issue still in China in particular, where there is strict regulation on some of the anesthetics and analgesics as well. And you do need to have the different segments to to address a different population. So you're practicing vets that can spay your pets that are truly owned, and also then programs that can address the other segments of the population as well. And it's very, very important to have those collaborative partnerships. So these are some of our programs that we run. So we have our low-cost desexing. We have our, obviously, rescue and rehoming program. We have our trap, neuter, and return program. And we also have something called the spay neuter assistance program, which is a voucher scheme where we will give a discount to a pet owner who is going to take their dog or cat to a private clinic to get it desexed. So we're just basically trying to support everybody in getting as many animals as possible desexed in the different segments. This is our spay neuter vehicle, so we're very lucky to have a donor who we've had one since 2002, and we're very lucky to have a donor. So we've just changed the vehicle, I think, 2 years ago, and it services a lot of animals. So these are the breakdowns of our output on that. So you can see the blue is dogs and the red is cats, and over time the cat ownership is becoming more popular and more cats are being desexed on the spay neuter vehicle, as we call it. Unfortunately, in 2020 we had COVID, and we managed to keep the programs going pretty well to some degree because of Hong Kong's policy on quarantine and epidemic control. But then when we did actually get COVID in Hong Kong, that impacted our operations. We never shut down the programs. It just meant that when people were on quarantine, when they were infected and they couldn't come to work, we couldn't actually operate the programs because we didn't have the staff. So that was a challenge for there. Again, spay neuter discount. It's a discount voucher. It encourages and supports RPO, and we engage with private vet clinics. So we've got 85 vet clinics that participate. And again, these are the statistics. So you can see that demand has increased. Again, vet costs are increasing, so probably more and more people would like a little bit of discount off the increasing vet costs. And again, the switch is gone to more and more cats, cat spays and cat neuters as well. So our trap, neuter, and return program, the Cat Colony Care program, we celebrated our 20th anniversary in 2020. And this is targeting the street cat population, the semi-owned population, and the truly feral population. We also do our rescue with our inspectors and the rehoming as well. And obviously the idea, we talked about pre-sheltering programs earlier in the week with Tina. And, you know, a lot of these programs we run are actually designed to reduce the intake. So therefore we can help more of the animals that do need our help, that come in, that have been rescued. We can spend more resources on sick animals that previously we wouldn't have been able to commit resources to because there were so many healthy animals that were coming at the same time. And then that means that we've also got the foster parent program as well. And so now we've been able to reduce the number of sort of healthier animals that are coming in that need fosters, and actually work on fostering sick animals and also neonatals as well. So we're able to give more resources to animals that, again, we were being overwhelmed with in terms of numbers. Again, mainstreaming, just be visible, get out there. Just going out and doing a survey makes people aware of the issue. So, you know, you're gathering the information, you're doing the research, but you're going around the community asking questions, and then like, oh, we know you. You're the people who are talking about, you know, animals desexing. Do we let our dogs out on their own? Do we walk them on a lead? How often do they go out, etc.? And we know that you'll do desexing, and yes, we're interested. And so they can join up that way. But it also spreads the message as well. So again, the desexing week, we do displays. There's people in the community that are quite keen. They come out, they take photos, they do their own supportive measures around the programs that we run. And as I said, surveying is very important for your baseline data, but it is also raises awareness because you're just walking around and people spot you. So when you're doing your pre-survey, they're actually being educated by the fact that you're out in the community, or they're giving the information that, rather than education, that you're aware, you're around, you can help, etc. Going to schools, very important. So we do have education teams that go into schools and do humane education, but we also do targeted in sort of exhibitions or going in and talking about the specific programs that we do as well. We do pet carnivals, booth promotions on the street, and we do a lot of media work, trying to get stories and coverage in the magazines, and also obviously engaging with our legislative councillors is very, very important. This was the cat festival we had, which was basically all things cats in the center of Hong Kong. We had a big inflatable cat, and we had a Halloween theme. I think it was over Halloween, so we had sort of Halloween themed nights as well, and you could take your pictures. And we had the Lego cats, and we had tied to the tree so people didn't take them home as presents for themselves. But you had like spot the cat, so you had little things where you were walking around the street taking the picture, and if you got all the cats, then you got the chop. You just had a little chop thing. And this is some of the specific sort of advocacy we do for the street cat. So talking about the programs, case studies, etc. Just getting the magazines out there again so people can pick them up. Lots of cooperation. Our CCP program actually started with us going to the US. So if you do have the opportunity to go to the US, or some representatives at our organizations went to Animal Expo, and were talking with people who are advocates of TNR, and this was back in the sort of mid to late 90s. We also had some cat feeders who were doing this off their own bat. So they knew that they had populations of cats. We had just expanded our clinical services. And these people were actually coming in, bringing the street cats and paying for it out of their own money. So they were doing this work. And we recognized there was this sort of group of volunteers who were doing this work. And this was a methodology that could really help us reduce our intake and reduce the humane killing or the euthanasia and improve welfare of the cats on the street. So again, what can the results look like for cats and cat populations? So this is from International Cat Care. So you've got the pet owners, you've got the TNR groups, you've got the rehoming, and you've got the vet services all participating. So we're looking at where we get the animals from. Unfortunately, a lot of people still buy their cats from pet shops, and a lot of people are still giving cats as presents. And I would suggest the cats given as presents were probably bought from the pet shops. You're not probably going to go and, be able to adopt a cat from an adoption agency. So I'm going to give it as a present to somebody, because that would trigger some alarm. People do pick them up from the streets still. We heard about that from Gemma. So there is a lot of passive acquisition, and adoption has gone up. There's a lot more adoption organizations in Hong Kong. So the figure there has gone up incredibly. In terms of neutering, the percentage of cats neutered and vaccinated has always been relatively high, but you can see from 2005 to 2010 and 2018, we've got a massive increase in the neutering rate of pet cats. So that's hitting our 70+% that we'd like to see. And you can also see that the number of cats euthanized has dropped dramatically over the period of time as well. So these are just statistics that match when the Hong Kong government did their official pet census and statistics analysis. And again, cats rehomed is a combination of SPCA rehoming plus also AFCD, our government department, also allows cats to be taken out to be rehomed if they're brought into their centres and they're suitable. So this is a quick look at our overall neutering rate in terms of the number of animals we neuter and the number of cats that were being euthanized. And you can see the nice relationship that we want to see in terms of the outcomes. In terms of our cat colony care program, this is from the 20-year anniversary. We've sterilised over 75,000 cats, over around 2,000 colonies with about 1,800 active, a lot of volunteers, over 1,000 volunteers, and very, very importantly, look at the cooperating communities. So those are people, they're schools, building management companies, government departments. So it's not just the individual volunteers, the people who are caring for the animals. It's actually being adopted as a good methodology, because for many years, just having the cats caught and taken away, they'd just be replaced, they'd just keep breeding. So we've had a lot of engagement with corporate and government departments as well. This is just a map of where all our colonies are. We try to create some graphics, and we do have that, should be available online. And if anybody's interested to get a copy of that, it's in our paw print magazine. I can give you the link. And this is, we don't do an overall population survey. We only survey one area that we operate in because we only have limited resources. But this is our survey on the population of street cats on Llama Island. So it's an island population, very controlled, and it's got a classic curve, right? So that's what you want to see if you're doing cat population management with a free-roaming street cat, feral cat population. So now when we go, we very rarely see any cats, and it's the odd one or two. Again, this is looking at the number of street cats we were sterilising and the cat euthanasia rate. So again, we're having a significant impact. And of course, we don't want to see our street cat numbers going up and up. So I like it that it's going down gradually. And then this is looking at the neonatal kitten euthanasia rate and the numbers of cats desexed under our cat colony care programme as well. And thank you very much. So there's some, any questions?
All right, so we will now open for Q&A session for Dr. Fiona. Are there any questions?
Do you get funding from government to run these programs for street cats?
No. So we did historically, and which was great. And they do recognise the program. So we chip all our cats. They're all desexed for free. They're chipped. They're given rabies vaccines, routine vaccines, and Revolution or whatever at the time. For a couple of years, we did get some funding, and then there was an ombudsman case. And at that point, they decided they weren't going to directly fund it anymore, but they still support it, but they don't give us financial funding for it anymore.
All right, are there any more questions?
Sorry, Doc, can you go back to the third or fourth slide?
Hang on, let me. The third or fourth?
Yeah, there was a photo of a man with a box.
Oh. Could have been easier to go back right to the beginning, but there we go. Hang on. Okay, so that's a cat box. So we used to have about 5 or 6 cat boxes around Hong Kong. So basically, if you had an unwanted cat, you could just open the front door and the top, and you posted the unwanted cat in, and then our inspector team would actually go around and empty those boxes every day. And I can remember one day we had an intake from one particular cat box. I can't remember the location, but there was a poodle, a hamster, and a cat, all in the same box. All in the same box, all completely alive and healthy. But, just basically, so if you didn't like your neighbour's cat, you could just pick it up and put it in the cat box. So, really not a good idea. So we were also almost enabling abandonment. But there were really, really significant welfare issues. A lot of these cats were really sick. I found a really sick dying kitten out in the nightclub area, like back in 1993 or something like that. But you now don't see that. You'd hear kittens meowing in the bushes. Volunteers are here. They can attest that the situation has improved dramatically, definitely for the cats. There are other areas and species that are still having issues. But we don't see the sick sort of street cats that we used to see. Now we're seeing 18-year-old street cats that are coming in, sort of in the final weeks of their life, and at that stage we're normally euthanizing them because, again, they're not socialized, and they've got terminal sort of issues like renal failure, et cetera, et cetera. So, that's a sort of a good problem to have, if you like. But yeah, we are actually, though, having big issues with the cat trade and smuggling from China with highly infectious diseases like FIE, Taobaoing cats, surprise gift box cats. Who knows what's going on? But it's a bit of a concern. So we're seeing a lot of disease importation. And then when these cats come in, they're abandoned on the street. So now we're seeing like British shorthaired, exotic shorthaired, very ragdolls, all abandoned on the street. What then happens is some cat lover picks it up, takes it home. They've got a couple of cats at home. They take FIE into their house, and the cat's sick, so then they take it to the vet, and then the vet says, it's got FIE, and they went, oh dear, we can't afford to treat it. We'll give it to the local animal organisation, so a cat shelter, so then we get FIE in the cattery. So it's a bit of an issue at the moment in Hong Kong. So pet trade regulation, very important.
All right, so that concludes Dr. Fiona's sessions. We will now move on to lunch. So lunch is prepared at Great Hall A and B, so you guys may proceed to the hall. All right, thank you.